All right, we're going to be talking about the subject that gives people a lot of pain: headaches, migraines, pain in the back of your head, pain in your side of your head, pain in your temples, pain anywhere in the head. Migraines that include all the visual and the throbbing pain and the I just can't take it, I can't function in life, I got to lay down and go to sleep, I got to lose a day that I can't even work. I've taken care of people who lose 3-4 days a month from migraines before we fix them and cure the cause of the problem. And what do they usually end up doing? Their choices are to either live with the pain, maybe go to sleep with the pain, or take medication for the pain, which most of the time is going to take the form of drugs to cover up the symptoms. Painkillers, sometimes even opiates, sometimes repurposed psychiatric medications are taken to take the edge off the pain, maybe make the pain go away, but still you have to deal with the side effects of those medications, and they are always something, and they're something you don't usually really want. Or you could cure the cause of the problem instead of just trying to live with it or cover up the symptoms. Now, some people say, well, I went to a chiropractor to get rid of my migraines or my headaches, but I could never hold the adjustment. It felt better when you adjusted me, but an hour later, a half a day later, a day later, it was back to where it was. And there's a reason for that we're going to discuss that is very common, most common to migraine sufferers, and the majority of headache persons as well, is a reason that they don't hold their chiropractic adjustments, because one of the key things that gives them headaches or migraines is compression of the nerves at the base of your skull, top of your neck. The base of the skull slips just a tiny amount and compresses the spinal cord and the nerves that control blood flow to the brain, and with the top two vertebrae, cervical number 1 and 2, those go into a misalignment relative one to another, and they reduce the arterial blood flow to the brain. When those nerves are pinched, your brain isn't getting fuel. And that compression at the top of the neck, base of the skull, cuts blood flow back to your brain. Well, your brain needs blood because it's the largest user of energy of any organ in the human body. It uses blood sugar, and it uses it all the time to be able to run itself. And that blood sugar needs to be smooth in delivery and even. Whether you ate an hour ago or 5 hours ago, your brain wants level blood sugar. When you have headaches and migraines, there could be a number of causes, that's true. It's not every headache and every migraine is caused by what we're talking about here, but by and large, the great majority of them are, and this is the thing you fix. The rare ones that have very unique and strange problems going on in their brain, they are not the usual. This set of problems we're talking about right now is the usual cause. And when you can cure the cause of a problem instead of just drugging the symptom, you're way ahead of the game. You're doing the right thing. So when you have pressure at the base of the skull, you need to adjust that. It takes precision chiropractic to move those vertebrae or that skull back into position relative to the neck and take pressure off the nerves. That has to be in the hands of a well-trained and well-experienced chiropractor who knows how to do that. And then you've got to be able to hold that adjustment, and you've got a problem when you've cut the blood flow to your brain. It's like the fuel pump for your body isn't working. But the other problem is the fuel power isn't usually right either. And that's because of low, crashed, or exhausted adrenal glands, which we cover in some other video classes. And in this case, we're going to have to mention the importance of this factor, which is when the adrenals, which are related to stress, mental, emotional stress, eating stress from people who overeat carbs and sugar, crash their adrenals, and even pain is itself a stress factor. So a person who has had injuries and accidents or has autoimmune problems, they have low adrenals, and their pain is making their adrenals even lower. So when we have that problem with the adrenals, we have to be able to use the right supplement. When we use it and in the exact proper dosage, we can usually pull the lowest crashed adrenal people up in a matter of a few days to a week, to the point where they can hold an adjustment. We can adjust the neck and base of the skull, get it into place, get the blood flow restored, and with the adrenals coming back to normal and teaching the person how to eat properly so that they balance the right amounts of protein, the right amounts, not excessive amounts of sugar and carbohydrates. So people who over drink soda, overeat sugar, overeat bread, pasta, cereals, rice, all the different potatoes, all the different carbohydrates that can throw your body into an insulin reaction, throw your adrenals into a crash, cause problems that are affecting the fueling of your brain, and then you've got pressure at the base of your skull, top of your neck, boom. Those are the two ingredients that are going to cause the majority of headaches and migraines. Those are the things we have to fix. If we get the right adjustment, if we get the right adrenal kickstarting, if we get the supplementation right and the food eating in some sense of balance, voila, we've got the problem actually cured at its cause. And I can't tell you how many, actually thousands of patients I've had who are chronic headache sufferers, chronic migraines that have stolen days every month of their life, that are relieved to be free of that problem once and for all.